for a parent to feel powerless and watching them in debilitating pain and no medicine in your cabinet is going to fix that, it's heart-wrenching. You know, it's not until we came here when we finally got the help that we needed.
The Pancreas Care Center at Cincinnati Children's is one of the only dedicated pediatric pancreas care centers in the country. Our extensive team of specialists help with rapid diagnosis and effective therapies, including pain management.
Pain is part of the normal human experience, but chronic pain for children and teenagers is not typical.
It hurts really bad. It's just really awful. It feels like a shark bit your stomach.
They're going to look at your pancreas, but they're going to look at your life too. They're going to look at how pain affects all those different domains.
And what we like to offer is kids really a toolbox of things that they can use to help manage their pain, like diaphragmatic breathing, guided imagery, and progressive muscle relaxation. We also help them figure out how to be involved with their daily activities, like going to school and doing things with friends, but at a level that they feel they can do without overdoing it.
It's a skill set. This is some real, what we call cognitive or brain work, thinking work, on how to restructure the neural pathways, the nerve pathways between brain, spinal cord, and body to alter the way you feel and process pain.
They taught me different ways instead of pain medication, so coloring or drawing, and what we found, makeup worked really well for me.
These approaches can help make many symptoms manageable, but for those with debilitating pain, our gastroenterologists may recommend an operation called a total pancreatectomy with islet autotransplantation, or TPIAT, where the pancreas is removed, the gastrointestinal tract is reconstructed, and islets, the insulin-producing cells, are transplanted into the liver.
Children do very well after the total pancreatectomy with islet autotransplantation. Patients can get back to life, back to school, even back to competitive sports within just several months.
While in the hospital, patients use an analgesia pump to help manage their pain.
As far as the kids know, they have a button they can hold in their hand, which they press with their thumb. And when they do, they get a small amount of pain medication in through their IV.
The surgery recovery is very hard and difficult and exhausting, but after it is so worth it. I would do it 100 times.
That's the number one goal of a TPIAT, is relief of pain and debilitation. It's actually very typical of what we see in our population of patients.
You have to come to a big enough institution where there are enough of the key players here to be able to create that experience.
We have incredible commitment from all of the subspecialties. We meet multiple times per week.
And if someone is having a major problem, we talk about it until we have a plan. And if everyone's doing well, it's a fun time to be able to get together and cheer.
I felt like I could do anything because I just wasn't in pain anymore.
Seeing Ellie this morning and Gia is just a fantastic experience. Both are doing amazingly well. They have no pain, completely pain-free, off of all opioids. To see this outcome where patients are back to life, that's the most amazing thing to me.
I 100% got my life back.
I was a bird and I flew free, and it was awesome for me. Thank you, Dr. Nathan, and thank you, Dr. Haja.